Hey everyone, I'm back. I'm here to give a quick update on how things are with my vision. I promised you guys I'm going to let you know how my what was my first post surgery checkup, what the results are for it, and where my vision stands. Um, so first update. My optometrist said that I have 20/20 vision on my left eye and 20/25 vision on my right, which is good. It was the right eye was 20/30 or 20/30 vision. Yeah, 20/30 vision, and it has now reduced or it has improved to 20/25 vision, which makes it 22.5 combined, which is not bad. I mean, it's close to 20/20 vision, and doctor still feels hopeful that my vision will continue to improve after this. So let's see. It's good news. I have also returned back to work. I started working on from the 21st of yeah 21st of February. So it's been about a month and 8 days since I had my surgery, and then 8 days back I resumed my work. Um, the good thing is now I don't need my glasses to use my monitors and laptop. Like I can see even every tiny font on my screen, um, and it's crystal clear. It feels amazing. I still like I feel strange not wearing my glasses, and fortunately my doctor recommended that I should continue wearing my sunglasses outside, wherever it's bright. So I actually, what I do is I wear my sunglasses in the office as well because it's too bright in my office, and it makes me feel like as if those sunglasses are acting like as my glasses, so I can see clearly. But that's not the case. It just makes the entire experience a little more smoother because for about 10 years I've been wearing glasses, and and all of a sudden I don't have to wear them, so it feels very unreal. Um, as for double vision, and I spoke to my doctor about this, and what he has to say that it's unfortunately it's just my right eye being having muscle weakness. Uh, what does he mean by muscle weakness? I do not know, and I feel like I don't know if maybe they are interrelated, but I feel like it could be also because of how I'm using my cell phone. Uh, right eye used to be my dominant eye before, so I was using my right eye more when I was staring at my cell phone. Like I do have quite a bit cell phone usage. Sometimes I use them for like 6 hours altogether, right? Continuously, because I work in tech, so my phone comes. I use my phone as my laptop. I do stuff like, yeah, I troubleshoot stuff, and I do my work basically from my phone, um, most times. So maybe over the years, using so much cell phone has reduced my muscle, strength. I'm just assuming. I don't know. I'm not a doctor, so I can't say. But in all, what doctor says it's muscle weakness, and he still wants me to continue just using eye drops for the next 3-4 months, so in total 6 months, and see how the progresses. It's possible that my muscle weakness might improve, and it might get strengthened as I go away from using steroid eye drops, because these steroid eye drops also have some role to play in how my vision, how my vision or my cornea, how it works. um, so we'll see how that goes. But as I said before, my because my what do you say, my vision my vision has improved quite a bit, so it kind of balances off the double vision. um, but it's mainly more difficult when I'm when I'm exhausted. My eyes are tired. I tend to feel that my double vision issue is more at that time. But yeah, let's wait it out for a few months and see how it goes. It's hard to say how things are right now, as the vision is constantly changing every few weeks. Uh, I also wanted to touch on this topic for my what do you say, my corneal thickness. I think this is something someone brought it up in the comment section, so I wanted to discuss that. I took some photographs of my reports at my doctor's office so that I can tell you how my vision was just before the surgery, like how what my corneal thickness was just before the surgery and how it is right now. So from what I see, uh, my left vision had four. Is it four? Sorry. Yeah. So my left vision had 454 thickness, and my right vision has they don't make it clear on this. Yeah, so my right vision has 484 thickness. So 454 on my left eye, and right eye is 484. Now, I find this surprising that my right vision had 484 because I remember doctor telling me first, I mean the person who did my surgery, that my thickness is four, it's somewhere in 470s. So again, there's not really a whole lot of difference between that number because I feel like that could be, that could be just margin of error. But the left eye, uh, yeah, but the numbers overall look correct. Especially the left eye definitely looks so. I remember reading 454 somewhere in one of my reports, at both the optometrist as well as the laser center, that it's around 450s. So uh, I unfortunately do not have the reports for 2019, when it was first detected that I have keratoconus. But I remember it was somewhere between, as far as I know, it was somewhere between 470s in my left eye and 490s in my right eye, or maybe it was 480s. I unfortunately do not remember. It's been too long. Um, but yeah, I had thin corneas for a long time, and only this year I decided to actually act upon it. Um, Now, the big question is how what's my cornea thickness now after the surgery. So the left eye, the where Dr. David thinks that I do not have keratoconus, so he didn't do a CXL. My cornea thickness is 409 after after doing the surgery, and my right eye is 373. So from 454 in my left eye, it now has come to 409, which actually is not bad at all, like in the amount of corneal thickness shaving what they have done. It's not bad at all. uh, but on the right eye, going from 483 to 373 seems quite a bit, loss of thickness. And to me, it's concerning. But what doctors say is that it's not bad actually. For the amount of work they have done on my eyes, it's this not bad. And doctor seems to be pretty chill about this. He's like, yeah, these number looks great. He was expecting more. He was expecting my thickness is going to be lower than this, but he thinks this is actually a good number. I don't know. As long as my vision is fine and continues to be like this for the foreseeable future, I think it's fine. Only time will tell. I just have to continue with my eye drops and just ensure that I don't rub my eyes. I feel like rubbing the eyes had made the situation worse. It may not necessarily that I'm genetically predisposed to getting a keratoconus, but it could be rubbing my eyes. Like I know I used to rub my eyes quite a bit, so I'm not surprised. But Yeah, I don't think so. I have, my vision can afford to have another correction done in future if this were to happen again. So I have to be very careful with how I'm treating my eyes. Um, Also, someone in the comment section asked about corneal haze. I wanted to touch on that. Um, so they mentioned that I have slight corneal haze in my left and the right eye. Uh, this was last week when they tested it. Like I don't see any haze per se. Like my vision is very clear. Especially my left eye, it's super clear. Uh, but but if I have slight haze and and it seems to be naturally with the eye drops what they're giving, if it's going to continue improving, then I think I might be able to see even clearly in the next few months. So I feel like that's a good news. As long as I'm able to get rid of that haze. Uh, Also, I feel like I have some droopy eyes. Could be just because I'm tired end of the day, or maybe it's the eye drops. I don't know. But yeah, yeah, we'll see. Um, Other than this, I do not really have anything to say. I think vision has been improving weeks after weeks. I think I have seen the most difference in the last 2 weeks, uh, and I don't think I'm going to see a whole bunch of difference in the next week or so. So I think it's going to be more of a monthly affair. So I'm not sure when I can give you guys another update, but I'm thinking that maybe in a month's period I should have another update to see how things are, if I'm seeing any differences in my vision. I do have another appointment coming up soon, not soon, sorry, next month. So I'll see how that goes, and if what my doctor has to say. It's funny, I'm looking at my doctor's reports right now. I remember telling him that I have double vision, but he didn't actually write it down. All he mentioned was that I'm happy with my vision. So I'm going to chat about that with my optometrist and see why he did not make a note of it, or if it's just a casual comment that I'm happy with my vision, because I am happy with my vision. It's just I was hoping that my double vision problem completely goes away. So we will see. Yeah, so that's the update for now. If you guys have any questions, shoot me a message on comments and I will try and reply them. Thank you.